Today, what we're going to do is talk about something that I'm really passionate about, is photobiomodulation, fancy term for red light, near infrared light therapy, and how we can apply it to the body to help us heal in an innovative way. This is ancient medicine, but it's something that over time that we've learned that we can use it in a very simple, very powerful way that we've maybe ignored in the past. We get so fixated on in-clinic, in-office, in-lab procedures that sometimes looking longitudinally, we miss some opportunities. So we're going to talk a little bit about that and how this can affect your life as a human being, every cell that you have, your family, your husbands, wives, children's. This can help tremendously with their health, and I want to get that across. We're going to talk about the science, and we're going to talk about how we can simply integrate this into our practices, but more importantly, okay, you heard with Dr. Young, into our lives. So what are we going to learn today? Kind of the why. This is ancient medicine that we're going to talk about and how we can use it in the modern day. We're going to talk about how we're using it and the specific wavelengths that we're using and how it's really creating vitality in our tissues, improving circulation, dramatically improving recovery, and the practical, really the what. How do we do this? How do we integrate it into practices in an ethical manner to help our patients, but also to make our practices more profitable, make it easy. And so it's a really nice adjunct to everybody's practice. And we're going to move this medicine that's been relegated a little bit to laser therapy in office machines to something that we can leverage at home. And so our mission as a business is to educate the clinicians, educate doctors, and help you deliver this care and extend the walls of your practice for your patients. I'm a musculoskeletal radiologist and interventionalist that got lucky enough to spend the last 20 years of my life understanding regenerative medicine, cellular therapy, the imaging of it, like the diagnosis, the treatment, understanding how tissues heal from that imaging perspective and diagnosis, and treating about 20,000 patients with regenerative medicine, PRP, stem cells. I started back in about 2007, got lucky enough to be introduced to PRP, treating bone, joint, spine disease. Currently, I am teaching around the country. I am doing CSO work for Redvive, thank goodness, and really bringing that background and education to our practices. I've been president of the International Orthobiologics Foundation. I've spoken at the NIH and FDA on stem cells and regenerative medicine for spine and joints, treated NBA athletes and stars from all over the world, and it's been just an absolute pleasure. What did I learn as a physician was, precision diagnosis. So I'm really key on diagnosis of what's going on, precision biologics, what we're using, and then precision delivery. And so we used mostly autologous cellular therapies all over the spine. I've done about 1,500 cases of intradiscal disease, injuries, cervical spine, high-level interosseous therapies, and it's a really nice translation to what we're doing with dental implantology. And that was kind of my mixtures that we would obtain from the patients. This was our armamentarium there, and then using image guidance. We kind of had our triple threat. I like sports, and so this was our triple threat. That was the autologous fat liposuction that we used, and we were using that as a graft. You guys can see that image there, and it was very viscous, super clean. There's nothing added to that, just liposuction and cleansing the tissues using centrifugation, and that acted as a scaffold. This is one of the cases, and this is what we were able to do. So part of this is what's possible, right? You guys are regenerative medicine docs. Like what you're doing with implantology, that's regenerative medicine, right? You are doing that. So how do we augment? How do we make it better? How do we have less pain? How do we have better outcomes? So how do we do that is one of the ways is using light. So we have this light-enhanced therapy. And what we realized over the years was if we implemented this in the right way, it made our procedures less painful. It made the better outcomes better, going from mid 70% success rate to the mid 90s. Just amazing results. And some stuff that I'd never believed would heal, that we were able to do that together. And so this is a case of a high-level athlete equestrian, got kicked, spooked her horse, got kicked in the knee, looked down, her knee patella was dislocated. She had completely destroyed her knee. So MCL, complete ACL rupture. The first image here is the MCL. This is an MRI. The MCL is completely destroyed. In the middle, this is the ACL. I'll walk over here and show you guys. This is the anterior cruciate ligament, and it is completely ruptured. There's a big hole in it. The knee was really unstable. So these are 3 separate surgeries, and this is the MPFL. There's a patellofemoral ligament that's completely ruptured. 3 surgeries, 18 months of rehabilitation for this person. We were able to do this with stem cells. So this is an image of the precision healing. We place stem cells percutaneously, needles placing these stem cells into the joint, into the tissues, and then using photobiomodulation on an everyday basis. This patient went home with our panel, used it day and night, and I'm going to tell you why, and they were able to recover completely in 7 months without cutting the knee open, without destroying ligaments, without taking grafts, without doing anything. They left with Band-Aids. They were walking in a week. They were actively doing physical therapy in a few weeks, and they were healed in 7 months. So this is possible. What can we do in every single field in medicine by enhancing our cellular mechanisms, right? By turning on those biologic systems? It's pretty amazing. This is another one, full thickness articular cartilage disease. I have circles here so you can see it. There's a huge cartilage defect. So here's a full thickness defect. There's no cartilage there. We did an injection, and this is something, some of the other docs are looking at, and even in dentistry, is we injected the bone. So we took this cellular material, we went into the bone and injected the subchondral bone. And by injecting that subchondral bone, that's where a lot of the pain and inflammation and bone marrow edema that we see on MRIs is at. And we placed this needle, this is a Jamshidi needle, into the knee in precision placement, where that defect was. This is contrast, this dark stuff here, showing that we're filling that subchondral plate. And then this is 6 months later where there's brand new cartilage. There was no Oates procedure, there was no microfracture. This was simple injections, Band-Aids, easy injection, and photobiomodulation, right? Stimulating that. So that's the pre and the post. That patient just did the knee. As we're starting to understand the biologics of photobiomodulation, there is a huge benefit to do systemic therapy. So on the abdomen, large surface areas that are stimulating systemic stem cells. But what I wanted to show is just some of the options. And so this is another one where there's a full thickness defect. This was injected with cells, and now there's new cartilage, and this is several years later, right? So this is something that's possible. I just wanted to open up eyes and say, this is what we're able to do. And the same thing with discs, with soft tissues, ligaments, tendons, and I've lived it. So how does red light matter to all of this? So I got exposed about 8 or 9 years ago. And this was somebody who was talking about a bed that a clinic opened up next door, and it's a $150,000 bed. And they're still at them. These are amazing devices. But I went there and started, and I felt immediate benefit. Better sleep, less pain, less anxiety. It definitely helped. I had an Oura ring. My sleep scores were tremendously improved. And I got a membership, and it was $200 a month. And that first month I was going a lot. The next month less, the next month less. I just stopped going. And I stopped seeing the benefits. It wasn't the medicine. It took me years to realize it wasn't the medicine that was failing me, it was my pattern. It was my dosing. I wasn't going enough, I wasn't getting the benefits, and it was hard because I have 5 kids, as you've seen, a busy life. My wife's a physician dermatologist. We're busy, like we do not have time. And so this stopped happening, and I wasn't taking care of myself, and then my body suffered for that in many ways. But as a physician, I was using energy-based medicine over the years, and we had in-clinic devices, shockwave therapy, EMTT, M-Sculpt, Neo. We were taking care of world-class athletes, of CEOs, of executives, of just normal people, and we wanted to give them every single benefit. That's what I see, that commonality. Like and it was a cash pay business. So when we did procedures anywhere from $1,200 to $25,000 stem cell procedures, there was no insurance coverage. We are highly accountable, right? So if it failed, it sucked. And I can see that commonality with implantology, that if you're doing this, you want it to work. And so we use any and all devices. And what happened was, over time, we were not using red light therapy because of the ROI. It was a big unit. I thought we needed a $150,000 bed. So I was just sending patients out. Go do this therapy if you want it. Hyperbarics was another one. Really fascinating. I think great technology. Hard to implement in a clinic. I didn't want the risk. And so we looked at this. One of my patients brought this to me. He's sitting in that chair. Brought this to me, said, "Doc, you got to try this panel. I've been using it for folks that are sick, dying. We were working with the company and we really like it. Can you try it with your patients? Can you try it with yourself?" And I was super skeptical. I'm like, that's $150,000. That's $2,000. I think that one's better, right? That's just going to be better because it's more expensive. Maybe not. So I took it home. In the first few days, I noticed dramatic improvements, just like I was with the bed. And it felt good. Just feel it. It's a very powerful device. And then everybody else in my family felt it. And they loved it. They all started using it. I have 5 kids, 4 really good athletes. And my wife, she's an avid hiker. But I started noticing immediate improvements in pain, immediate improvement in instability with my EDS. And over time, increases in strength, vitality, all the things. Sleep scores were better. So I was really impressed with it. And I said, okay, this is kind of cool. I want to go learn. Like, I need to dive into this field. So I went to Europe. It was lucky timing. They had the World Academy of Light Therapy and was blown away by the medicine. I said, this is legit. So what I'm feeling is very real. How do we implement it into the practices? And what I learned was light is light. The wavelengths are the medicine. And another super important thing, you have the right wavelength is dose. Just like with any other medicine. This is a medicine. It's an ancient medicine from the sun, but its dose is really important. And I learned all the different fields that it was neurorehabilitation, stem cells, antimicrobial, antiviral, reproductive health, metabolic. You can see there was 153 lectures in every single field imaginable. And there was a reason. It was because we're treating cells. And if you're living, your cell has mitochondria, and that's what we're affecting. We're affecting the root cause, right? So is it snake oil or science? And yes, it could be both. If we use it improperly, it's snake oil. If we use it properly, it's science. It's all magic until it's science. So we have to understand how we can leverage it, where we can leverage it, and how we can use it. And so there's a lot of studies. There's 10,000 or more publications in Medline and PubMed. You have 600 clinical trials. If we look at, then we're going to go into kind of dentistry of how powerful it is. But here is like photobiomodulation therapy. Look at this trend. These are all trends. So photobiomodulation in pain, photobiomodulation inflammation, wound healing. What do you see there? Thousands of articles, and there's an uptick. There's a trend here. We're using this light medicine, whether it be lasers or LEDs. Ours is an LED-based device. It's the same medicine. We're using that medicine on the tissues to help us heal. There's a lot of studies. That's a lot to get through. We've created Redvive University for our affiliates, our doctors that are working, clinics that are working with us. We want to educate, and this is an ever-evolving process of gathering those articles, accumulating them, the full articles, PDFs, so it's very manageable and easy in all the different fields. Dentistry, TMJ, podiatry, musculoskeletal health. So in all these different fields, and we want to do that. As a patient, my story, I have EDS. If you can see on stage, I can bend my finger like this. My thumb can touch my elbow. Elbow hyperextends. I have a biting score of 9. So, good at yoga, bad at football. And so I break down. My tendons break down. And I've had 18 PRP injections, a few stem cell injections. I've had listhesis at 4 or 5. Right? I'm on the bed here, and I'm getting my disc injected. This is my spine. And that's my Achilles. On the left here, there's a huge hole. This was the most painful thing I've ever gone through in my life because this took a long time to tear, about 18 months. And I was miserable and nothing was working. Stem cells, PBM, that's a year later. The PBM, photobiomodulation. So to me, it's given me my life back. And so regenerative medicine is my passion. I've never had to have a surgery. But this was me, even after healing. This was 18 months ago, 2 years ago. I was an inflamed mess. And I started using photobiomodulation, right? And this is EDS, and this is not about just aesthetics. This is about biologic change. This was EDS instability, pain, and loss of function. I was trying to work out. I was on testosterone replacement therapy. I was trying to work out every day. I was going to the gym, and I was injuring myself continuously. And I was just super fatigued. I started doing this, and I did not expect this. This was for pain, right? I started using PBM for pain, most of the times in the beginning, once a day. Then I started using it. I started to learn the science. We're going to talk about that, using it twice a day. And I noticed first, less pain. Second, more energy. My inflammation was down. I was stronger. I could open the door without tweaking my wrist. I could sit down for long periods of time without hurting my SI joint. My lifting, bench pressing 135 to 6 months later, 225. Like, it was incredible. And that was the change. This was me a few weeks ago. And that's not just aesthetics. This is biologics. This is not just something that came from change in any other kind of supplements or medications. This was light therapy. And so why did that work? What happened? And that's why I'm so passionate about it. Like, EDS affects a lot of patients. They're unstable. They're scared to move. They're hurting. But that's in all of us. Either energy levels, fatigue, aches or pains, arthritis. We can leverage this. So photobiomodulation is modulating the biologic system with specific wavelengths, right? We talked about the wavelengths or the medicine. That's this red and near infrared spectrum. It's very special. It's affecting a special photoreceptor in our body, and that's why it's working that way. It stimulates mitochondria in the cells on that cell surface. There's a certain photoreceptor on the surface of the mitochondrial membrane, that inner membrane, that we can charge. And it triggers a natural healing cascade, reduces inflammation, and enhances tissue repair. It provides this cascade. It's a stimulus. And PBM, we jokingly said this is also, because you guys have running businesses, this is photo business modulation. And we were laughing about this as tongue-in-cheek, but it kind of stuck, because really at the end of the day, the more success you have, the more patients you're going to have. right? And the better business you're going to have. So why does light therapy, like I'm kind of a spiritual person and I love this as we started to learn about why does light therapy work? This is ancient medicine. What's really cool, and we'll talk about that. And why specifically red and near infrared? And why does daily exposure, why does twice daily exposure make the most sense? So every cell in our body, right, it's a cell receptor. Every cell is a receptor. It's also a translator of light, right? From the first unicellular organisms to now eukaryotes and our mitochondria in our cells. Why is this important? So over 400,000 years, we've been humans. And if every one of those days in those 400,000 years, there's been a sunset and a sunrise. And the reason why our bodies, every cell in our body is attuned to that pattern. There's a rhythm. There's a solar rhythm. When we have the sun that's high in the sky here, and you can see this person down here, there's a very direct pathway. And the high energy waves, the ultraviolets and the blues, they're going to come down and hit that, and that's going to be the dominant energy source. When the sun is at a low angle, so the person that's way over here, that's a 15-degree or less angle, what's going to come through are those longer wavelengths. The UVs and the blues get scattered. The reds and the near-infrareds come through. What happens in the morning? When we were living in caves, under trees, how did we wake up? What was our biologic signal? It was the sun. So as the sun was rising, what do our cells? We need to get up. We need to produce more energy. Our mitochondria need to work. So that's what's happening. When the sun is a low angle at the end of the day, what do we need to do? We need to go to sleep. We need to rest. We need to recover. So our cells are attuned to that medicine. And so that's the reason that we're bringing this medicine back. Can anybody guess what the percentage is that we stay indoors, in your car or inside? 93% of the time. We are missing a signal. We're missing the signal. We are getting unhealthier and healthier. There's so much research out there on this. We're able to take this. This is kind of a supplement. This is not replacing the sun, but this is supplementing it. And we're understanding, like, why does it work? The why is so important. It's fascinating that we can take this energy. Our biology is built for this. There's this kind of Goldilocks zone, right? Blue, too hot, too superficial, damaging. This Goldilocks zone, 600 to 900 nanometers. It's going to weave through the cells. It's going to hit the mitochondria. It's going to stimulate healing. The mid or far infrared, when we get into the 900, the 1,000 nanometers, the target is different. It's water and it heats. And there's benefits to all of these, right? We need vitamin D. We need, detoxification. There's benefits, but there is this specific medicinal approach to these wavelengths. And that's why those are so important. So these are chromophores. These are the photoreceptors in the skin. You have hemoglobin, or in the tissues, hemoglobin, melanin, water. But we're focused on these opsins, cytochrome C oxidase. And that's our focus. That's our very specific medicine that we're treating. There's a few different pathways that we can stimulate that. There's opsins in the retina and the eye cells, circadian rhythm, and there's tissue pathway. Today, we're really going to focus on the tissue pathway. There is fascinating information on sleep. We've been working with sleep doctors, and it's super cool how we can affect that. But it's just such a simple process. We're turning on this light. It's sending photons into our tissues. It's exciting this cytochrome C oxidase, this photoreceptor on our mitochondria. When that happens in low, diseased, inflamed states, which we're dealing with our patients, from mouth to joints to tendons, the cytochrome C oxidase holds on to nitric oxide. That's a disease state. When we hit that with light, nitric oxide is released. That's a good thing by itself. There's vasodilation, there's decreased inflammation, there's better blood flow, there's a cascade of benefit from nitric oxide release. When nitric oxide is released, that receptor is able to bind to oxygen. And aerobic oxidation, phosphorylation, the electron transport chain gets turbocharged. And it actually works really well. We produce 32 ATP per cycle versus 2 in the nitric oxide bound state. So we're creating a ton more energy. So that's phase 2. Right? So we have a lot more energy in the cell. There's gene activation and healing cascade that emanates from that. And this is all researched from these red light wavelengths, these specific ones. And they are in that 600 to 900 nanometer wavelengths. This is that cytochrome C oxidase, that protein, the red light's coming through, hitting it, dissociating nitric oxide. Oxygen binds, more ATP. So benefits from there. This is the electron transport chain, up to 16 times more ATP production, so that cell has more currency to heal. All the cellular processes that occur, And then that's going to stimulate stem cells as well. There's a reactive oxygen species burst that occurs. There's change in nuclear transcription factors. And I don't want to put you all to sleep, but there's a process that occurs. And at the end result is new protein creation and gene synthesis and healing. You get into an anabolic building phase. And we see this with collagen, soft tissues, muscle, bone, gingiva, and there's stem cell activation. So when I talk to patients or when I talk to kind of more lay people, this is my holy trinity of photobiomodulation. So what is it actually doing? Because it's hard to explain all of that science, but it's performance, so mitochondrial activation, energy. It works on TRPV1 receptors for pain relief, and we'll talk a little bit about that as well. So there's an analgesic and neural healing benefit as well. So if you put red light, near-infrared light on, you come down, if anybody has pain or discomfort, sit in front of that panel. Part of it's, there may be some heating, but that's not the goal. But it's really this nitric oxide release, blood flow, and there is modulation of TRPV1 receptors, and you will have immediate pain relief. As you continue to do that repetitively, you will actually have reduction in neural inflammation, and you'll have nerve healing. And then lastly is stem cell release and regeneration. So there's an active release. If you they've done studies, and I'll talk about that, for 15 minutes of PBM, just on the tibia, and they measured blood levels of CD34 cells, circulating stem cells, 2 hours later, it was increased by 300%, macrophages by 1,000%. And that stayed for 1 or 2 days. So you can microdose. Imagine every time, like who doesn't want more stem cells? That's going to heal all the tissues that we don't even know are breaking down. That's going to help with post-surgical implantation. That's going to cross the blood-brain barrier and treat brain disease, which we're seeing with Parkinson's and neurocognitive decline. So it's a biologic amplifier. So here's some of the PBM neural support. We have all these articles. So if anybody's interested, we'd love to send you more information. I'd love to talk to you. Analgesia immediately, neural inflammation modulation secondarily, nerve healing and regeneration tertiary. This is kind of cool too. Another way that you can leverage photobiomodulation is in the lab. It's called ex vivo. You can actually take your cellular products, put it underneath the light. We talked about anything that has a cell can respond. And you can photobiomodulate that tissue for 60 to 90 seconds and turbocharge it, which is amazing. So super safe, non-thermal effect, and you can use an even more turbocharge. And so this is the studies they're showing, and they actually showed blue light was detrimental to it. And they did 660, 810 on ADSCs, adipose-derived stem cells, and they saw tremendous benefits. So we saw increased cell viability, metabolic function, cell migration, proliferation, and mitochondrial activity. Another recent study that just came out 2 weeks ago showed that they were looking at exosomes. We've all heard about exosomes probably. They were looking at exosome size when they treated stem cells. Not only were the stem cells showed these properties, but the exosomes that they were eluting were much larger. They were holding more mRNA and more information. So you're stimulating all these biologic processes. This is the study I talked about where they did just tibial stimulation for 15 minutes, and they looked at CD34 cells and macrophages. So you're stimulating biosynthetic pathways, and we can continuously do that. And this is just with gentle, low-level light therapy, right? But it's that continuous dosing that when you do that over time, it makes a huge difference. And the other piece is dose. Like, why is our device better than anybody else's device? But I know ours is specifically built to have these biologic changes and affect these changes well. And so you need the right wavelengths, you need the right medicine, and then you need the right dose. So if you have the right medicine, but it's a really low-powered device, you're not going to get the dose. You're going to have to, even if you wear it for a long time, like some of these wraps are so low-powered that you're just not going to deliver the energy into the tissues that you need to. They may help very superficial skin, but if they're not powerful enough and you're not getting a dose enough, it won't work. If you take 1 milligram of Advil, is that going to help you? No, you need 200, 400, 600, so you need the right dose. How do you get the right dose? Number one is the power of the machine, the irradiance, how much energy, how many photons are coming out of that light source. That's an important factor. Number two, how far are you away from it? If you have a super powerful light and you're 2 feet away, if you come to our panels, you'll still see the light and you may even feel some warmth. It's not going to change your biology. You need to be close. We've measured the dosing. You have to be close. 6 inches away, up to 12 inches. There's an inverse square law. The farther you get away, you lose a lot of the energy, and it's not going to be effective. I'm passionate about teaching is how do we get the best dose? We've created some protocols with all the different fields that we're working in. It's important to develop the protocols to understand, the physics, like how much energy can penetrate the tissue, the skin, the buccal mucosa, hit the gingiva, get to the periodontal bone. It can get there. That's why it's really cool, but you have to have the right dosing, the timing, and the intervals. Irradiance is how much energy is coming from the source, and the irradiance changes by distance. So the irradiance is the measure of energy. So if we have this waterfall analogy, how much water is coming out of the waterfall? We want the right fresh water. We don't want salt water, fresh water coming down the waterfall. When it hits our tissue target, that's the skin, or if that's the deeper tissues, the skin surface irradiance is how much energy is hitting that skin. So how much water is actually getting there? Because there's going to be attenuation in the air. Now, how much energy is hitting the skin is irradiance. And then the attenuation is how much we have lost, right? And that's even the tissue target. If the tissue target's deeper than the skin, then you're going to lose that. So we're going to lose 80 to 90% of our energy that's coming into the skin by the time it hits the bone. But it will have a powerful biologic effect on all the tissues that it's going through. And then even the 10%, if we're doing that day and night, 5-10 minutes, day and night, day and night, day and night, that accumulated dose is going to make a huge difference. And that's where we're going to see the benefits. And look at your metrics, right? So BIC, BOP, all these three, TLAs, we love three-letter acronyms, right? So all of these things, like if we're measuring those, what are the outcomes? I think we're going to see amazing benefits if we have this accumulated dosing. Right now, all the studies, and they're showing benefit, they're doing 2 megadoses with a laser in the office. And then they're letting the patients go. And they're saying it's great in the beginning, and then it tails off. We stop treating them. What if you took it home? This simple device, what if we showed them how to do it, and we started measuring and giving these outcomes over time? I think we're going to see amazing change. They're really seeing that with even these small doses. I think as we start to accumulate that dose, it's that compounding effect. We're going to see some amazing things. Attenuation, we talked about Monte Carlo dosing. There's a lot of physics and calculations that have gone into oral mucositis. That's been the first insurance-covered indication for cancer patients. They're using extra-oral photobiomodulation to heal those. That's now the standard of care, gold standard of care and insurance covered. And then the therapeutic window, the right amount of energy in the tissue. And we talked about that Goldilocks, that same theory. Too little, no effect. Too much, overstimulation, not a good result. There is a sweet spot. So there needs to be biologic harmony. Fresh water coming over the waterfall, the right medicine, the right dose, the right therapeutic window, and the right tissue response. So there is an art to this medicine. So from science to practice, we want to have the integration mindset. And so here's the beauty of PBM. How we used it in my clinic, as soon as somebody wanted to do a stem cell procedure, a spine, a joint, they went home with a panel and they started preconditioning. We wanted to change that biologic milieu. We treated, and I think the same thing is happening as I start to look at implantology and dentistry, what we were doing for patients with joint disease or spine disease, especially joints. We call it joint treatment as an organ. But we would look at the joint as an organ because a lot of the old school thinking was, okay, you have arthritis, it's just a cartilage disease. It's not just a cartilage disease. It's a cartilage disease, it's a bone disease, it's a subchondral bone disease, it's a synovial disease, the lining of the tissue. It's a neural disease, right? And it's a systemic disease. Who are the patients that fail on you probably the most? Diabetics. They have poor blood supply, poor oxygenation, metabolic syndromes, and all these other issues. So when we're treating a patient, when we're looking to treat them regeneratively, we want better clay to work with. And so one of the powerful adjuncts we can do, you see what the medicine can do for you, is send them home early, precondition. Get the device home. Okay, we're going to do this procedure. You're going to go and you're going to start doing PBM systemically, and you're going to do that for a couple of weeks, and we'll give you the protocols. When they're coming into the office, you're going to stimulate them before if you're doing any harvesting or bone grafting. That's what we were doing for the patients. Ex vivo, you're going to stimulate your medicine that you're putting back into someone. And then post-therapy for analgesia, a different way of using the device. Shorter bursts, you can use it every 6 hours, and that'll cause that decrease in neural inflammation and pain. So less reliance on narcotics, pain medicines, anti-inflammatories. The recovery phase. So this is something, again, I have a background in musculoskeletal disease. How do we use this in implantology? How long do you use it for? Is this a 6-month course to get that full bony integration and soft tissue healing? And understand, how do we leverage this best for our patients? That's that recovery. And then the thrive. What I love is that patient, there's very few things in medicine that you're going to give to someone that they're going to keep forever and using it. Most of the time it goes back in the closet. That's not the case. Like, I'm so passionate about the medicine, how it's changed my life. I want the patient to use it for the reason they're coming to see you, but then they're going to use it to thrive. We're all aging. We're all going in the same direction. Let's do it the best way we can. And this is something they can implement in their lifestyle to change. So we educate them, and that's where this photobiomodulation can really come in together. This is literally a fixture in our house. Everybody uses it. This is in the office, like biostimulation. This is in the lab. You can see the PRP or the cells that we're treating. This is actually from a doctor in Arizona. And that's that we talked about this ex vivo, tons of literature, super fascinating. And we're doing some studies now to actually understand like how it affects different cellular tissues for regenerative medicine. Post-procedural analgesia. This is my daughter. She's a pole vaulter, got hurt. We used it for a huge hematoma that she had on her leg. So this is something, we have these different phases of using this device. And there's slightly subtle, there's differences in the way that we use it and the timing. Long-term wellness, sleep architecture, neurocognition, stem cell recruitment, anti-inflammation, energy support, pain reduction, collagen building support. This is something that we're going to use for a lifetime. That was some of the information I came back with from Europe, is light is light. Like you're creating that same light from a different source, but it's that same wavelength. As long as it's the same wavelength and it has the same energy, you can deposit in the tissues the same depth. Then also depth of tissue. There's a misnomer of how much collimation a laser has versus how much depth it'll penetrate. Right? As soon as it hits that skin, that tissue, it scatters, it refracts, it reflects. And the same thing happens with LED-based light. But the depth of penetration, how deep it goes in, is almost entirely a result of the wavelength. So it's that red wavelengths, they'll penetrate the skin, the subdermis, and then the near infrareds, that's probably going to go the deepest. And there's a misnomer of the mid and far infrared, the 1,000 nanometers, they're going to go deeper. You hear that a lot in the kind of marketing, but it won't, because what's the target is water. And as soon as it hits intracellular water, extracellular water, it stops penetrating and it heats the tissue, it heats the water. So it's really good at sauna, right? So that's not a bad thing. It's just a different medicine. It's a different target. So the total energy is the key. And so if you can put in, is a laser, if you do 5 minutes of focused laser therapy and you do 5 minutes of our device, is the energy that's placed into the tissue even close? No. But if you take this home or you use it on a continuous basis, does it take you very long to catch up with the joules that are getting into the tissue? No. Skin exposure, proximity, dose. So the longer that you stimulate the tissue, those benefits are going to cascade, right? Because you're having biologic and systemic benefits. So there's targeted therapy, there's regional therapy that you're getting, and then there's systemic therapy. So you have kind of three levels. What you're seeing here is this, you also have a much larger skin exposure, right? A larger soft tissue exposure. So you're getting this, I liken it to if you were taking a medicine and a laser is like taking a syringe and a needle and injecting a sponge. You're going to get a really high dose in a very focal spot. One of the downsides is you could have some thermal effect, but the other is that you have the laser, especially collimated, and a more substantial power is you have some thermal effects. You need that in an office setting. It's a medical grade 3 or class 3, 4 device. They can't send it home, right? So that's a challenge. This is a class 2 medical device. So it's deemed safe for patients. You can send it home, which is a good thing. Over time, you're getting a larger soft tissue dose, and that compounding effect, we're going to see that benefit over time. So that's really exciting. So it's this cumulative dose. If someone came into your office and you could do laser all the time for 8 weeks, and you wanted to do that 2 or 3 times, yeah, I mean, you're going to get more dose in that tissue and you're going to get more concentrated effect. Is it feasible? Probably not, right? So is this something that could fit in that gap that we can send patients home? It's easy, it's painless, it feels good. The accountability is there. So there's a low barrier of entry. The cost is pretty effective. So there's a lot of benefits. So really it's physiologically very intelligent to use this medicine. And I think across many, many different fields. And then we just have to understand how we can best use it in specific settings, right? I think neurocognitive decline, you could say, okay, somebody has Parkinson's. There's a ton of data on Parkinson's, like really beneficial. And what they're seeing is that you can do it transcranially, but you have to have a high dose, long periods of time. And one issue is I don't have to worry about it. Like if you have hair, it blocks all the energy, right? Hair is a really bad substance for light to go through. So you don't get any dose if you have significant hair. So then you have to do frontal, temporal, back of the neck to try to get that dose. What they realized is if they did abdominal stimulation, they're stimulating immune cells, and they noticed near equivalent benefits versus sham for those patients. So they're turning on biosynthetic pathways. So something that we think about is, hey, you're going to stimulate here, but would it be a bad thing to do another 5-10 minutes on the abdomen? Probably not. Dosing frequency, regional systemic coverage, the compounding effect, and then the biologic adequacy. It's like if we start early and you see why it works, why not give them that opportunity to take it home and use it on a daily basis, or develop a protocol where it makes sense that we're not overdosing them, that we're properly dosing them, and we're getting the best outcomes. And then lastly, the business case. Redvive, you can see there's a lot of leadership here. We really want to support like what we're doing here. If we're going to, sell a device to you, that's just the beginning of the relationship. This company was built in my clinic, and the things I asked was I want a world-class product. I want it super easy to use. I want it to help our patients. I want to have a strong educational platform. I want to have no stress on my staff. I don't want to hold inventory. And if I'm going to work hard to learn this and I'm going to treat my patients and I'm going to be an advocate or PBM expert for my patients, I want to financially benefit from it. And if you can make those things happen and it's seamless, then I'm interested in working with the business. And Mike and the team, they were able to do that. And so once they did that for mine, it was easy to go and replicate. So it's really a system of support. We have an amazing product and we're continuing to innovate, pushing the medicine forward. And so we'd love to work with you. We have a system that helps you integrate this, make it simple. We teach you the science, and we're also going to teach your staff. We're going to teach them how to implement it, how to educate the patients. It's all drop shipped. Our company is based out of Oregon, so it's really easy. You get to talk to the patients. Oftentimes we bundle it with different therapies. Sometimes it's a standalone. It's shipped to their home. If they don't like it, they ship it back. So very simple, powerful. It fits naturally with our therapies. Think about whenever biology is stressed, this is a great application. And here the biology is stressed with implants, with dentistry, but it's also in all these different fields. AM, PM dosing, it just makes sense to use those triggers. If you're going to have to dose this medicine anyway, use what Mother Nature has taught us. That's going to give us our best systems. There's studies, really interesting studies, animal studies, where they treated them with light. And in the morning, in the AM hours, if the animal had a normal circadian rhythm, they created more ATP in the morning than in the evening. Pretty crazy. So the cells are smart. And in the evening, they saw greater increases in melatonin and growth hormone and suppression of cortisol. So the system, the same light, different times of the day, different effect on our body. Targeted systemic treatment. And it's kind of an invisible efficiency and quiet amplification for your patients. So we look at this, and this is the systemic, like every cell, right? What are we doing? Mitochondrial ATP production, angiogenesis, oxygenation, soft tissue product, collagen synthesis, bone growth, pain modulation. Any field can use this, and it's really akin to this. So hopefully this helps with all the patients that you're helping and changing lives. This was Redvive University, just to show you. We used Notion. And so this has all the articles. So there's if you guys want to get leveled up on PBM, which I find fascinating, these are the articles in all different fields that teach you about photobiomodulation. So the discussion sections are really good with these. So these are kind of the mechanistic aspects. We have implants, so extraoral PBM, medical protocols. So we're working on this with the doctors. These are not just me creating this, but I'm working with thought leaders and clinical physicians in creating these for different fields. Medical talk tracks. This is something on the business side. If someone signs up as an affiliate, they'll kind of walk you through the process. That this is a relationship that we're building, but we're really helping integrate that. We have meetings just with your clinical staff, those key stakeholders in the business, to help move this forward. Once you are a believer, we want you to evangelize. And so we have created Innovators of Health, and their docs who have used it. They've used it for 6 months, a year, love it, transformed their lives, their families' lives. Like some of the stories are pretty incredible. It up-levels and differentiates your practices from the norm. And so this is something that we want to support for you guys as well.
Redvive has been, an amazing benefit to clinics and physicians in creating another revenue source of value, doing it ethically with a powerful medicine that works and doing it effectively. This business in a clinic for a clinician. We wanted something that was very powerful, very effective, and very easy, right? And provided to the bottom line. My main role is to educate the clinicians on how to leverage the medicine, how to understand it, how to talk about it. And our team will help place that medicine into their clinics, into their offices, into their lives, where they can affect hundreds and thousands of patients. And so to make it easy, understandable, digestible, let you get patients excited about this, let's bring that to their home and get them feeling better. And then let's hit your bottom line and your revenue and increase that so you can be an even better advocate for your patients. Not only are we, ethically doing this, that we're using this amazing medicine and technology to help our patients, but we can benefit financially and be around for them as well.